So we are going to go ahead and call to order the meeting of the Board of Supervisors for Monday, April 27. We begin today with a flag salute, and this one is going to be led by Mr. Bosch.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
And Melinda will read the statement of meeting procedures, please.
Welcome to the Placer County Board of Supervisors meeting of April 27th, 2015. Agendas are available on the table in the back of the room. If you are here to speak on an issue not appearing on the agenda, you may do so during the public comment period. There is a 3-minute time limit per speaker. The board is not permitted to take action on the items addressed under public comment. When you speak, clearly state your name and address for the record. All items on the agenda will be open for the public to address before final action is taken. There's a 3-minute time limit per speaker, which will be monitored by a timer on the podium. If there's a person speaking on behalf of a group with no other testimony from another member of the group, please identify yourself as such, and your time may be extended at the pleasure of the board. Keep in mind that the chairman has the discretion of limiting the total discussion time on any item. If you are hearing impaired, we have listening devices available. It is requested that all cell phones be turned off or put in silent mode. Thank you for your participation and cooperation.
Thank you, Melinda. This is the time for public comment where any member of the public can address the board on anything that is not on our agenda, knowing that no action can be taken on items raised in public comment. If you come forward to speak under public comment, please let us know your name and where you're from, and try to keep your comments to 3 minutes. Is there anybody who wishes to address the board under public comment? Wait, this is Tahoe. There's supposed to be a whole... see, there we go. Yeah, come on, this would be the right time if you have something you want to chat with. Either that or you're just upholding the tradition. Either way, we appreciate it.
City. Ooh, power. If it turns out it's on your agenda, could you give me the high five? I wasn't able to look at it.
Okay.
And all the people I asked weren't sure.
Okay.
Excuse me, running to get here. It's my understanding you've been examining a trash, wildlife, human conflict situation with an idea of moving forward with some policy or some recommended action. And I just wanted to offer to you, I'm actually going to be attending a conference in Canmore in middle of May. That is a gathering of Western North American bear folks. And one of the big topics is this. We're going to get a tour of the Canmore-Banff area. We're going to hear from guys in all different regions about what they've done to improve their situation. I'd love to come let you know what they have to say about it in case it helps your process. Just wasn't sure if the timing was right. So.
That's great. Tomorrow we'll be having a conversation about that, but thank you for bringing it up, and I know that Supervisor Montgomery, I appreciate you staying in touch with her and letting her know how that conference goes.
If you would mind giving me that name one more time, please.
Supervisor Montgomery, this one.
Oh,
right
Supervisor
here.
Montgomery.
Yeah.
Oh, Jennifer.
Jennifer.
Gotcha.
Jennifer,
Okay.
yeah.
As we call her around the state.
Yeah.
Thank you very much.
You're welcome. Yeah. If I had a nickel for every time I wanted to be able to say that. Anybody? It's Tahoe, come on. Anybody else want to address the board under public comment? All right, seeing none, we're going to go ahead and jump into the first of our two very brief timed items, right? No. This first one is a conversation that we will have led by Andy Heath in regard to priority-based budgeting, and the board receiving a report on how other folks are looking at their budgets these days. Andy?
Great, thank you, Mr. Chairman, members of the board. Andy Heath with the County Executive Office.
Push the button.
Push your button.
Is that better?
Yeah.
Okay. Thank you, Mr. Chairman, members of the board. Andy Heath with the County Executive Office. What I'd like to do today is invite the board to participate in a conversation with respect to priority-based budgeting and some of the efforts that the county has taken up to date over the last couple of years as we progress along the path of priority-based budgeting. And then with that, listen to Chief Michael Schwartz from the Tahoe Fire District and have him talk about his implementation efforts with priority-based budgeting. And then also Jeff Brown and Rebecca Malott from our Health and Human Services Department, where they actually will tell you about a pilot process that we've been embarking upon to actually implement priority-based budgeting within the county. For the presentation outline for today, we'll kind of go over what pilot priority-based budgeting is and exactly what it entails and why it's important. Talk about Placer County implementation efforts to date. As I mentioned, over the last couple of years, there have been some significant things that have been done by county departments to actually lead us along the path to develop a priority-based budget. Identification of strategic priorities. This will be where we invite the board to have a conversation with staff to look at strategic priorities that may already exist and do already exist within the budget framework that we have today. However, within the framework of priority-based budgeting and the way that's implemented, we may want to look at that a little bit differently. So we'll go over that with strategic priorities. And then, as I mentioned, Health and Human Services will give their overview of what they've done to date in their pilot process, and also the North Lake Tahoe Fire District in what they've done as well. And we'll talk about next steps. So what is priority-based budgeting? Essentially, priority-based budgeting is a common sense strategic alternative to incremental budgeting. As you are aware, there are many ways to put a budget together. A budget can be put together based on the amount of funding that's available. It can be put together based on needs. It can be put together in many, many different ways. What priority-based budgeting does, however, is it looks at a different way of putting a budget together, where you're actually aligning the costs and the results of certain programs and the services that are offered within the county to the priorities that are actually stated by the county itself. Moving away somewhat from an across-the-board approach, where typically in the past you've seen organizations in a budget downturn arena where there's been a recession, incrementally cut budgets by saying everybody cut 10% across the board. This is a deterrence from that. It invites you to rather look at areas and programs and actually consider what those programs are offering to the public without having to perhaps cut those programs 10% because of their importance and their relevance to achieving the stated priorities. And then it also helps with the realization of the new fiscal reality. There is a new fiscal reality out there where there are a considerable amount of taxpayers that they just don't want to pay any more taxes. So our tax base is what it is today. And with that tax base, we as a county need to make the best choices in how those tax dollars are spent. This is another alternative to actually providing you, the board, an opportunity to look at programs and services and what those programs and services accomplish in terms of what they're doing to meet your stated priorities and the community's stated priorities, so that dollars can be allocated in that manner. Also, priority-based budgeting is a philosophical approach of how to budget those scarce resources. As I mentioned, tax dollars are very scarce these days, and we need to move away from funding departments more so, where departments are being funded today. If you have the different departments across the county, into an arena where we're actually funding programs and services, where those programs and services may cross multiple departments across the county. Also enhances a pathway for increased fiscal transparency and meaningful stakeholder engagement. In that, ultimately, it's at some point in time in the future, with priority-based budgeting, we're going to want to know what the community thinks, and we're going to want to know what all the stakeholders of the budget and the services that the budget that's adopted provides, how those services are provided to the stakeholders, mainly the community and the board, and get their feedback along the way. And then again, there is no one-size-fits-all with the budget. You can't really look at priority-based budgeting there's only one way to do this. One of the things that you will see as I go through the presentation is that we've really taken an incremental approach to priority-based budgeting, and in some ways have done things a little bit backwards, where you actually have stated priorities established first, and then you work towards that. But what we've done is we've actually gone through a process that I'll go through in beginning to align what we've done to those priorities. And then, of course, alignment of funding and resources requirements to deliver programs and services with strategic priorities and value to the community. Ultimately, the funding and the resources that we do get within the budget framework need to be aligned with strategic priorities and the value that that the programs provide through the budget or the compelling public value all needs to be aligned together. That's what priority-based budgeting does. So again, it's another mechanism. It's not the budget itself, but it's a mechanism for the board to consider on how services are ultimately delivered to the community and how they link to the priorities and the strategic goals that the board and the community has defined as important. Looking at a roadmap, how do we get there and what is required, and some of the things that the county has done to date. One thing that we've done is we've really looked at transparent communication of fiscal health, and I have a slide that goes over this, but it's really important to indicate to the community what we've done from a fiscal perspective in setting ourselves up so that the community can be very, very clear about exactly where the county lies fiscally and how healthy or unhealthy the county lies. Transparent communication of some of the things we're doing with our budget and financial policies is critical along these paths, and we'll go through that. And I'm happy to say that the county is in a state of good fiscal health, and we're moving forward in that direction. Development and refinement of programs and services inventories. One thing that we actually had departments do, as you'll see, is go through and look at all of the programs and services so that ultimately those programs and services can be aligned with the priorities that they achieve. We've done that, and we'll go through that. And then what we're doing right now and spending a lot of time on that you'll see with our HHS department is alignment of costs into programs and services and some of the pilot efforts that HHS has been working with. Focusing specifically on the transparent communication of fiscal health, some of the things we've done along these lines is looking at incorporating economic analysis and long-term planning into our decision-making processes. As your board is aware, staff does have a 2-year budget model and a 5-year budget model, 5-year model framework that we have, where the 2-year model looks specifically at the existing fiscal year and the coming fiscal year in a lot of detail, where we're actually looking at what the expectation is for revenues and expenditures in a much greater amount of detail than we would in the 5-year budget, where the 5-year budget helps us understand exactly what we anticipate will happen long term so that we can make decisions today that ultimately prevent something that may transpire long term and impact the budget as a whole, basically getting in front of any economic issues that may transpire. That 5-year and the 2-year model is very critical to our budget process from year to year. Being transparent about the true cost of doing business. And with this, we're basically doing this now, where we're aligning the costs to the programs and services and to the departments that have those costs built into their budgets on an annual basis. Some of the things that we've done over the last couple of years is we've really looked at A87 costs, the indirect allocation overhead costs that are built into the budget, where taking those costs and making sure they're apportioned correctly through correct allocation methodologies to the departments that are actually incurring them is happening. And you'll see that all departments in the county now have an allocation of some sort of an A87 cost, where in the past they may not have because those costs may have been pooled into a central appropriation. And then looking at alignment of other costs into programs where we're entertaining more involved internal service funds. This year with the budget for the first time, you will see that an information technology internal service fund and an employee benefits internal service fund, where we're taking those costs, pulling them together and allocating those costs specifically to departments for the departments that use them, as opposed to just allocating them across the board, which we're trying to get away from. So being transparent about the true cost of doing business is critical to demonstrating the fiscal health of the organization. Understanding variances, budget versus actual. We actually have a monthly process in place where staff goes through and looks at budget actual variances that are happening over time for all of the county's major funds. When we see these things, if there is an anomaly that we're seeing, we may come back to the board at some point in time, whether through the mid-year process or if we see something happening right away through the final budget process, where we can actually get in front of that and make decisions. So this helps us really understand what's going on in the economy today at a given point in time so that we can make decisions as we move forward. Of course, establishing and maintaining reserves. As your board is aware, the county has funded the general reserve in the budget at the 5% minimum threshold target level that's discussed in the county's budget and financial policies. And there are several other reserves that the county has as well, where we have capital reserves, we have a reserve for the public safety fund, and all of this is in place consistent with being fiscally prudent about having something set aside just in case something might come up, as we saw during the Great Recession. And in spending within our means. And what spending within our means basically means is that we are using one-time revenues for one-time expenditures, and we're using ongoing revenues for ongoing expenditures. And really trying to stay away from using those one-time revenue sources to fund ongoing programs, where some of those one-time revenue sources may even be 3-year grants, like a fire safer grant, where you get a grant for 3 years, and then after that period of time, that grant goes away and you have to keep those costs within your budget. We need to really understand what this means to the budget process as a whole, which is why it's important going back around the circle to really incorporate that economic analysis into our long-term decision-making with the 5-year budget, so that we know once that grant runs out, what does that mean to the picture in the long run. So all of these things basically add up to making sure that we are able to demonstrate in a transparent manner, which our budget document clearly does in all of these areas, that the county is in a good fiscal health position. To do priority-based budgeting, we have to have this. Second thing that we've actually done is that we did with the fiscal year 14-15 budget is we developed programs and services inventories list. It's actually in the budget document itself. You'll find it in the proposed budget and in the final budget, where we had all the departments in the county go through and identify, without a whole lot of instruction, because we wanted the departments to be free with how they responded in terms of what their programs were, exactly what their programs were. So you will find that in the budget itself. There's a couple of hundred programs that are discussed in the budget. Some of them are more verbose than others, and one of the things that we're doing this year with the fiscal year 15-16 budget is actually looking at that program and services inventory and refining it so that we can create a more concise list, more succinct list, so that it is very apparent to the user of the budget when they're reading the programs and services inventory exactly what they're getting in that program and what's being offered. So what I have here on this slide is just the programs inventory for Veteran Services Department that was put together by John Melrose and his group. And you can see that they have 4 core programs and then what those programs offer. So this will be something that you'll see being refined in the budget coming for fiscal year 15-16. The budget is currently being developed. So then we have an area that we're actually working on right now, and a little bit later in this particular item, you will see you'll hear about the HHS's Health and Human Services Department's efforts in their pilot process, where they're looking at actually beginning to align costs into programs. Right now, we're currently we have worked with the Auditor Controller's Office to look at a way that we can allocate using the county's existing financial system to allocate and track costs by defined program. Right now, the county does have a structure, a cost accounting structure that's built into the PAS module, the Performance Accounting Series module, that we use in our financials, called OCAs and PCAs. And what OCAs and PCAs are, they're organizational cost accounting allocation structure and program cost accounting structure. And basically, through these OCAs and PCAs, you can allocate costs to a particular program or area. And these areas, the ability to do this has really enabled us to move to this in some departments more than others fairly quickly. And those are with those departments that actually use the OCAs and PCAs in their accounting structure. We've also looked at developing alternative mechanism where we're actually going deeper into the accounting structure, where we've created a new string within the financial system of numbers that will allow us to begin to align these programs and services that are being defined by the departments with actually the priorities that they go to achieve. So we're working along those lines as well. As I mentioned, in 14-15, HHS is doing a pilot process, and you'll hear about that. And then with the 15-16 budget that's being developed right now, there are actually 7 departments that are involved in putting together their budget from a program costing perspective. Admin services, assessor's office, the auditor's office, community development resource agency, the library, personnel, and probation, all will have their budgets presented in an area of the budget for the final budget as cost budgets for the programs that they have. So that will be coming before your board as well with the final budget. Another goal of the alignment of the costs in the programs and services is to actually not just look at costs, but actually look at the non-discretionary revenue sources that go to these programs as well, so that your board and the community can understand exactly what a service or a program might be costing long-term. This is important because there are a lot of programs within the county, particularly in the Health and Human Services Department, that do have a considerable amount of non-discretionary revenue that they receive through federal and state sources that go to offset specifically the types of programs that are being offered. So it'll be important to understand exactly how much net county cost or general fund money is being used to support each one of these programs and services, and to how much is being allocated. This becomes very integral especially with those programs and services that may be mandated by the state to be provided, and understanding exactly what that mandate is and what the county is doing, if anything, above and beyond that mandate, and how much it's costing. Priority-based budgeting will help us understand that to a much greater degree. This is the area that wanted to get some board feedback, and ultimately that we're going to be soliciting public feedback as well. And this is the identification of strategic priorities and really beginning to understand what the strategic priorities or what the strategic goals of the county are. With the building blocks in place that we've already done, where we've actually indicated what our fiscal health is, we've actually gone through and identified what our services and programs are, and we're beginning to align all of the costs that are attributed to those services and programs into the particular service and program. We're now at a point where we're actually ready to switch and begin aligning those programs and services into the priorities or the results that are expected from those services and programs as part of the priority-based budgeting process. As I mentioned at the outset of the presentation, typically you will have the strategic priorities or goals established first, and then everything kind of falls into place. And what we've done is we've looked at the core essentials that are necessary to put in place first before we actually go and consider our strategic priorities, which may already exist, as you'll see. Right now, the existing budget framework currently delineates community results by system with the system goal statement. And I added to your handouts today information that's actually in the budget document this year, where we've actually looked at in the past the 5 systems, where the county does have 5 systems, where we have the administrative and financial services system, health and human support system, community and cultural system, and 2 others named up there, and the expected results of those systems. This work was done in the mid-2000s, and it was meant to really indicate what some of the strategic priorities and the goals were of the county, and then what the expected results that the community has associated with those particular services, with those particular community goals. If you look at the system goal, you'll note that there are key words in each one of those systems goals, as you'll see on the next slide, that actually include certain things that may indicate what a priority or what a strategic goal might be. For example, this slide right here talks about the Public Protection Services system, where that system goal is Placer County continues to ensure safe communities in which to live, work, and enjoy recreational activities by providing efficient, effective, integrated, and prevention-oriented criminal justice and emergency response systems. If you look within that, you'll see the word safe community, where safe community typically across most jurisdictions is a stated goal to ensure that you have. Within the Public Protection Services system, which is now currently set up by department, so you'll have 4 departments that are aligned into the Public Protection Services system through the budget process right now, which would be the Sheriff's Office, District Attorney, Probation, and the County Executive Office with the OES function. Instead of actually aligning those departments into these particular systems or priorities, we'll be aligning programs and services, where programs and services, some of them maybe not in one of those 4 departments, may actually help to achieve the safe community goal, and they're achieving that priority. With the understanding that hopefully some of our programs, if not most of our programs, achieve not just one priority, but many, and that's why we offer them to the community and the services. So ultimately, that system goal or priority is embedded in there and in that system goal statement. So this work may already be done. Because it was done in the mid-2000s, it may be somewhat dated, where we actually have to go back and reconsider it and look at it and maybe have a conversation with the board about what some of our overarching system goal or strategic goals are from this type of perspective, and then more importantly to actually go out into the community and see what's important to them and engage the community as well, where we can use the internet and use the PIO function that's currently in a very robust state right now, and actually engage our citizens that way. Use the MAC meeting concept, where we actually go out to the MACs and engage individuals that way, and just engage anybody in any way, shape, or form that we can. I just wanted to mention that one of the things that we actually did was we took a model that was put together by Douglas County, Nevada, knowing that Douglas County, Nevada has actually implemented priority-based budgeting, and they have a set of overarching strategic priorities, which you'll see in just a sec. And what I did was I created buckets, and I put these priorities and some of the results that are expected through the delivery of these priorities by the programs that are offered. And on those buckets, there were 7 buckets because there are 7 priorities. And at a staff meeting that we had for our entire county executive office, and then at a separate private function that I attended, I actually had a conversation about priority-based budgeting, and had both of these groups put $100,000. We gave them $100,000 worth of county dollars, and had them participate in what we called the bucket contest, where they actually had the $100,000 to spend on any one priority that they thought was most important to them, knowing what the expected results were. Each individual went around, put the money into the buckets, and with the county executive office meeting that we had, the winner there was, well, not the winner, but the most important priority was safe community. And then ironically, with the a private party that I went to, where there were about 15 people there, the winner was, the leading priority was well-defined infrastructure. So you can see that it's kind of across the board, but when you engage individuals, you're going to get some good feedback and understanding of exactly what the priorities might be. What this does is I've taken a look at what our current county systems are, where you see the current county systems in the box on the left-hand side of the slide, where we have administrative and financial services, community and cultural services, health and human support services, land use services, and public protection services, with the understanding that these county systems, again, are set up by department. If you look in the budget document, you'll find that at the outset of each one of the discussion of these systems with this framework, on the offsetting page, it tells you which departments make up each of these county systems. Priority-based budgeting sort of moves away this, where we're not looking at departments specifically, but we're more looking at programs and services and the community results that are expected. If you move across from the box on the left-hand side, what those systems do, however, through the systems goal statements that we already have, where we see that each goal statement does have an indication of what a priority might be or what a strategic goal might be. The desired results from strategic goals that remain consistent over time can be found in each one of these systems goal statements, where public safety is a key component, healthy residents and communities, quality and sustainable infrastructure, economic vitality, ecological stewardship and preservation, well-planned growth and development, quality cultural, leisure, and recreation activities, where each of these areas becomes basically a strategic goal. And then with those strategic goals, with the understanding that each one of those strategic goals is a priority of the county, we begin to measure services and programs that are currently being defined, have already been defined, and are currently being refined by the departments. How each one of those programs or services achieves some of these priorities through the results, where those results can be measured by the program's ability to contribute financial stewardship, achieve regulatory compliance, community employee engagement, transparency and accountability, and adherence to best practices. Or each one of these programs and services can be measured using some of those types of attributes. And then again, with this, one thing that I said earlier is we want to know exactly how much non-discretionary revenue is going into each of these programs and services as well, so that we know, particularly for mandated services, where we have to continue to provide that service no matter what, as we look forward. So again, the goal of the priority-based budgeting framework is to align program and service resource requirements with the achievement of organizational priorities. It's very important to get feedback on exactly what those organizational priorities are, so that we can begin again to align the programs and services to those priorities. What I'd like to do right now is just pause and see if there are any questions that the board might have or any comments before we move forward.
Questions by board members? Yes, Supervisor Montgomery.
Thank you. On the community results, when you did your bucket analysis, the 7 goals
Correct.
that we were looking at up there,
Right.
did you define those for people, or did you leave those largely undefined?
Yes, what we did was we actually used the model that's been prepared by Douglas County, and what you'll find is that these 7 areas are the areas that Douglas County uses, and that within each one of those areas, it's a stated priority or strategic goal, there were results, where those results indicated what public safety was, what good public safety was, what achievable public safety was, where it's almost in alignment with some of the results that we have stated for our systems goals.
So people were working to the same definition?
Correct.
Because just looking at that, I could see how people could have very different interpretations of what
Right.
each of those meant. And in terms of, I wish we had the 7 buckets here today. It would be a fascinating opportunity to see how it worked out locally. But in terms of doing the public outreach, that would help the community to identify their priorities and priority setting. You listed a number of different organizations and entities that would work through. Would we also look at things like going to the business groups in the community, chambers of commerce? I mean, are we looking at a really robust outreach?
Absolutely. I think a stakeholder would be defined as anybody who uses the services that the county provides. And I would, businesses, nonprofits, obviously the constituents that each board member serves, the residents, the board themselves, pretty much anybody.
And how would you create a system where there were not duplications, say an individual who, went to every MAC meeting and weighed in on a process? Is there a way to control for that?
I'm sure we could figure out a way
Okay.
to control for that.
I'm probably getting ahead of myself in worries, but I'm just thinking about, the best way to have a really fair opportunity for people to weigh in once,
Right.
not multiple
Right.
times. Thank you.
Supervisor Holmes.
Thank you, Mr. Chair. In past budget cycles, we've had salary savings I mean, departments have funded positions that aren't filled, which results in salary savings, which results in carryover for the next year's budget.
Correct.
What effect is priority-based budgeting having on that process?
Great question. And that's one of the things that we're doing with fiscal health. Well, if you look at some of the things that actually go into fiscal health, one of them is alignment of costs and really understanding what the costs are and looking at budget to actual variances. Salary savings fits into those two areas where aligning the costs specifically into the departments and what those true costs are needs to happen. And that can happen by budgeting a salary savings component, which we're really looking at this year. And then, of course, understanding what a budget to actual variance is in every department. And then for ultimately every service and program where you'll have FTEs assigned to services and programs. If you see a large budget variance to actual, then you're going to ask yourself what caused that budget variance. And you're going to find out right away that a lot of it is for funded vacant positions. So one of the things that we're doing for the fiscal year 15-16 budget cycle is we're getting ahead of that. We're actually going to be recommending to the board a significant reduction in salaries and benefits related to a credit being built into certain budgets for that salary savings, where we're actually reducing the appropriation authority of the department by that salary savings amount, knowing that it's just not practical to have all the positions filled at any one given time in large departments. Approximately $5 to $6 million is being built into the budget for 15-16 for salary savings to right-size that budget.
Good answer, thank you.
Then, kind of along those lines, clearly one of the obstacles that you anticipate with implementation of priority-based budgeting is the notion that once the candidate evaluation of the priorities is done and a plan then to implement on those priorities is created, current staffing probably won't align with those priorities and what's necessary to implement. We, of course, unlike a private business, have the additional encumbrance of civil service job descriptions, our relationship with our public employees union, a number of different considerations that we would have to work through in order to make sure that the workforce and the positions are aligned with those priorities. Is that anticipated and built into the phasing in of this kind of a priority-based budget?
I think it would need to be. I think ultimately the unions would become a stakeholder of the priority-based budgeting process where we would obviously need to work with them and help make sure that they understand exactly where we're going. One of the things that I like to do is make sure everybody understands exactly where the county is from a fiscal transparency perspective and some of the things that we're working on. The moving to a priority-based budget, it should not be a surprise and it should not be new news. It should be something that everybody knows is going to happen. We indicated in our budget document, we indicated in the presentations that we give the unions when we have negotiations, and it's there, but they absolutely become a stakeholder in the process.
I think you might want to add the Civil Service Commission in that as well, given what this may mean in terms of their review of job classifications and descriptions being modified in order to meet the priorities. Supervisor Duran?
Yeah, I see us evolving into, just like we did on a 5-year budget, evolving into priorities. I'm more concerned with the process of how we get to those particular priorities and how we measure one concept or idea versus another one. So in my experience in working with a lot of governments, we use what we call SMART goals, which are specific, measurable, achievable, relevant, and targeted in order to flesh out what those things are. Because, I think it's a great idea to reach out to the community to get, ideas, but we have to stick to that framework of using those evaluators of specificity, measurability, relevance is a huge issue. A group of folks may want X, but if X isn't relevant to accomplishing something, then I think we're outside of the framework, and that does a lot of damage to what we're trying to do goal-wise. So I would that's what I'm going to be looking for when I evaluate whether or not this is a priority, and whether or not what we want to do is, with specific, achievable, all of those different SMART points. So.
And that's absolutely one area we will need to look at in the future. It's a step that we have not taken yet, where we're looking at ultimately when you have your strategic goals or your priorities identified, which could be as high level as some of the ones that are stated in these slides. You're going to want to have the result statements on, okay, what do we expect? How are we going to achieve those priorities? And then with these result statements, what defines whether or not a program or service is achieving this, and to what extent and to what level. And that's where we need to work with the departments very closely to determine what those attributes are. How are they going to gauge the success? How are they going to indicate what the compelling public value of providing any particular service or program is, and be able to articulate that clearly to the board, the decision makers of the budget, and then importantly also to the community on what that service provides.
Yeah, I whether it's SMART, SMURF, whatever, however we figure out, that's my contribution. So, thank you.
Okay.
Little blue gnomes notwithstanding, we'll go ahead and move on.
Okay. All right. So what I'd like to do now is invite Rebecca Malott and Jeff Brown up with the Health and Human Services Department to give the board an overview of what they've done to date as definitely a leading department in this effort. They've done a considerable amount of proactive work to really get to where they're at, and as such, they've kind of taken the lead in guiding the county along this path in working with our office and the Priority-Based Budgeting Coordinating Council, which is a group of individuals that's been put together across all county departments to implement priority-based budgeting. So I can invite Jeff and Rebecca up.
All right, thank you, Andy. Chairman Euler, members of the board, I'm Rebecca Malott. I'm the Director of Administration for Health and Human Services. So I'm excited to be here today and very honored to be participating in the pilot project for priority-based budgeting. For the past year and a half, my dedicated and staff and I worked tirelessly to perfect our new priority-based budgeting financial model, with the ultimate goal of aligning financial details and outcomes to programs. So today I'm going to briefly talk about the pilot's accomplishments, some of the challenges, some of our successes, and then our next steps. Uh-oh. Looks familiar. Or maybe not.
He's working on it.
Okay.
He'll bring it up. Although, in the interim, if you'd like to speak to the fire department.
Yeah,
Might be more
sure.
entertaining actually hearing it from you.
Might be a challenge. You might not want to hear what I have to say. Okay, there we go. That looks a little better. So we began this process by creating a detailed program inventory. I know that Andy spoke about it a little bit, but ours got to be a little bit more detailed, I think, than the high level that's in the budget right now. This involved three things predominantly. We examined every HHS program that we have and determined what priority-based budgeting groupings they would fall into. We determined whether they were a mandated or discretionary program, and then also if there's any required minimum service level that we had to adhere to. This resulted in more than a page. It was 131 programs in Health and Human Services. So next we had to set up a new coding structure in our financial software system to capture the expenditures and revenues into these priority-based budgeting groupings. So this was a very detailed process. involved lengthy collaboration with the CEO and auditor's office staff to basically ensure that whatever system HHS created would be usable for the rest of the county when they launched after us. So ultimately, as also I believe that Andy mentioned, we identified a 15-digit program number that we would use in PAS, our financial software system. The next two accomplishments were done somewhat in conjunction. We created a template for standardized reporting and tracking to share monthly with HHS staff. Since we had spent so much time on the front end with data input, we really wanted to create an efficient and effective way to monitor our data output, which is also just as important. So this reporting system was perfected as we created and worked through our implementation timeline for our 11 appropriations that we have to, in effect, go live. So our implementation timeline identified 4 phases that spanned a fiscal year for transition completion. There are 2 main reasons why we had to schedule an entire year for this implementation. The first, going back to the salary savings conversation, HHS did not hire any additional staff to do this work. And so all the work was completed by staff while they maintained their current workload as well. And then the amount of prep work that was needed before hitting the Go Live button was substantial. Just to kind of highlight a few levels of that, we had to meet with all program staff to refine our inventory. We had to align our current coding to programs, which for us, as the OCAs and PCAs were mentioned by Andy, we use hundreds and hundreds. So we had to align all those to our programs. We had to finalize the structure and provide training to staff. Obviously, they needed to be trained substantially on the new coding and the whole new structure that they need to use moving forward. We had to set up the financial software system once we identified our structure and what we wanted. And then we had to transition all the existing financial records. So everything that had been done to date, if it was a mid-year implementation, had to be recategorized into all of the different programs that we have. Then we had to create the new budget structure, load that into the system as well, so we could look at both the budget and the actuals to have the complete picture. And then we needed to monitor the system for any needed cleanup, which, again, being the pilot, that was some substantial cleanup needed at times, but that's how we learn our lessons and improve. And then our monthly reporting, which is obviously all this work to get to, our monthly reports for program financials so that they could see how their programs are doing. So phase 1 was successfully implemented on July 1st of 2014, and that was 3 of our 11 appropriations. Phase 2 went live on November 1st of 2014, which was 3 more of our appropriations. We're currently in phase 3 right now, working on 2 of our appropriations for that. And phase 4 is set to go live on July 1st, 2015, with our remaining 3 appropriations. And at that point, for the entire year of 15-16, we will have all 11 of our appropriations up and running on the new system. So full year's worth of data, so that'll be exciting. So being as this is a pilot, I mentioned there's been some challenges along the way. Staff really needed to have a solid understanding and knowledge of the appropriate use of the new coding, so training became absolutely paramount and took a lot of time and resources, but was worth it to get a better quality product on the outside. They also needed to have a real in-depth understanding of their programs, financially speaking as well, and that took some time for all levels of the organization to master. We also encountered some limitations of our financial software system, especially around accurate reporting of staff costs and overall staff level of expertise in PAS. It took some time for us to work together with the auditor's office staff so we could all get up to speed and be able to work on the system functionality together. And then there was some budgeting complexities for Health and Human Services. In switching from a single appropriation budget to this new by-program budget that is now within a single appropriation. So where we used to complete only one budget for, say, our children's system of care, for example, now we're completing 27 budgets within children's system of care, so some complexities around developing a system to automate that. And then more on a technical note, since HHS receives most of its revenue from external sources, there is a time delay in receipt of those funds. So monthly reports that we were producing will show significantly more net county cost throughout the year than what's actually going to be realized by the time we're done with year end. So there was some education around that as well. So even with all those challenges, we have some more successes to celebrate. The collaboration that I mentioned several times already between the CEO's office, auditor's office, and HHS has been priceless. We could have never accomplished all that we have without their guidance and their willingness to continually look at our challenges and help us overcome them together. Hopefully, all this great work and time that my staff and I have put in will pave the way for the other departments to have a much smoother and shorter transition timeline. That's one of our goals. See how we did. Another success is greater program transparency in HHS. So people who are not ingrained in our programs could still gain a basic understanding of exactly what it is that we do. And from a financial perspective, the public could see their taxpayers' tax dollars at work. So priority-based budgeting also enables more accountability for staff, as they now see program management reports once a month, and it helps them to analyze their cost data in different ways than they were looking at it before. They have started to find innovative ways to collaborate with other divisions within Health and Human Services who might be running similar programs, and they just didn't know that previously. So another success, it empowers program staff to own any of these needed changes that might be overlooked due to inadequate reporting or just not having the data in front of them. And then finally, and my personal favorite, it allows HHS to analyze programs and know them intimately at all levels within the organization. And we have found that that's encouraged engagement and ownership, so real positive spin. So with all this work that we've completed or soon to be completed, what are the longer term next steps of the HHS pilot? What do we feel we still need to accomplish? We have to update the 15-16 proposed budget once it's approved into the new coding system and then load it into our financial software system. We have to, very importantly, align the HHS program structure to Placer County priorities once they have been identified, and that could be some work for us, and we're looking forward to that and seeing how that's going to play out. We have to prepare, or we're looking to prepare, the 16-17 budget documents in a yet-to-be-determined but new priority-based budgeting format in hopes of next fiscal year only having one budget format to do instead of multiple. And we've started conversations with CEO office staff on this, and we really look forward to testing out a new process whenever it is developed. So, and then finally, we need to identify, track, and report systems for program outcomes, another really big piece of priority-based budgeting. And so I will, to elaborate further on this, I'll go ahead and turn it over to Jeff Brown.
Good afternoon. Oh, that sounds better. Got an echo there. Good afternoon, Chair Euler, members of the board, Jeff Brown, your Health and Human Services Director. I'd just like to take a few moments this morning to share with you a tool that we will be deploying in the near future to track program indicators across our department and share the information with our partners, key stakeholders in the community. We're in the process of contracting with the Healthy Communities Institute out of Berkeley. And they have a product they call their HCI platform, in which we're going to review just for a few moments here. And this is really a tool that's going to allow us to really look at the data that's available nationally, data that's available statewide, our local data, take a look at best practices, and really look at how can we really use this information to promote program improvement across all of our programs. It allows us to access a database of thousands of evidence-based programs to consider for implementation. And then most important, it just really allows us to share information throughout the department, the larger county, our county's communities in an easy to understand dashboard type of format. And we'll take a look here. This San Francisco has been using this format for a number of years. The Healthy Communities Institute works with probably 100 different municipalities across the United States, but certainly a number in California. And essentially, you can create a dashboard that can go up on your web. We're going to look at a lot of health indicators here. The one thing I want to take a look at, you look over to the far right, And you see some colors and you see some arrows. Arrows indicate trends. Green is good. Sometimes a good trend is going downward, sometimes a good trend is going upwards. But green is good and red is bad. It's very simple. And then the dashboard that you see, you know, again, green is good, red is bad, and yellow is somewhere in between, strive for green. If you see blue, that's really data that is neutral. So it's just something that's good to know, but there's really no judgment made about what's good or bad. And you can see in that column to the right, just to the left of the dashboard, they tell you what the comparison is. So it could be national comparison, could be with another county, could be with a previous value in your county. And so previously, I'll go back, you can see we're looking at access to health indicators around insurance. You can see there's some cancer indicators. There's also some notations regarding maps, and we'll jump into one of those. Diabetes indicators, disability indicators, comes with the platform. Exercise, nutrition, and weight. And so one I thought we'd take a look at, 7th grade students who are physically fit. If you click on the little green button that says map, you essentially drop in. Now this is San Francisco County, so you can see that they're scoring relatively well in this indicator, but not as well as some of their neighbors. So you see Marin County to the north, you see Alameda County on the right, and then you see San Mateo County, Daly City and the like. And you can see that their indicator is 65.3%. To get to green, they've got to go a little further, 65.5%. And then there's pediatric asthma. They're not scoring so well on pediatric asthma, neither is their neighbor Alameda County. You can see that it looks at hospitalizations per 10,000 population of kids 18 and under. They're almost double what's considered a good level there. But one thing to look at also on the right is there's other resources there. And this is where you can see some of the other indicators you might be interested in related to asthma. But there's also some promising practices that are listed. And if you drop a little further on that same page, you can actually get data over time. So you can actually see, are you improving over time, or is your improvement moving in the wrong direction? And so there's a little red line there that shows that they actually changed the methodology about how they would measure that indicator. But you can see still the numbers are getting worse. But more than health data here, we actually have economic data that will also come with the platform. So it ranges from anything around economic climate and employment all the way just to income of our citizens. Some of this comes from census data. And there's other information here. You can see demographics, but also there's one around civic engagement. And it actually looks at voter turnout. So you can click on the map and you drop down into our last slide, and you can see here that this was probably the highest voter turnout they've ever seen. And so as long as you're using data from 2012, 73% voter turnout. This was for the 2012 election, probably the presidential election. If they mapped the last election that we had in California, it would show that we all suffer some challenges, that this is the only indicator you use for civic engagement. But this is something we're going to hopefully get up and running this summer. What we really plan to do with it is we plan to link it to our work with priority-based budgeting. We plan to show, the data that exists in existing databases, which is what we're buying. But we also plan to gather our own local data. And there's actually a method where we can load that and put that on our website also. So it's something that we're going to be using to reflect on our programs, to better manage our programs, but also to make our outcomes transparent to the community and really have the community be able to look to see where we're making progress and see some of the challenges we're facing and where we need to make more progress. So that's the extent of our presentation. We're happy to answer any questions you may have.
Supervisor Holmes.
Yes, thank you. Great work, Rebecca. I really appreciate the work you did. What I'm excited about is the successes enables more accountability and innovation for employees and empowers program staff to own needed changes. That's huge in your department.
Yes.
Because so much of that work seems to be, I don't know, but it would seem to me that it's rote, that you just have to keep doing it, and there's a better way to do it. It's a better way, it's an easier way for them to bring that to you or to Jeff in order to implement those changes. I just have one question though. Mm-hmm. What did you do in your spare time?
Had a baby.
Well, that's productive. That's productive, okay.
It's honest, right?
We're actually like, giving her more assignments. We're trying to keep her busy at work.
Good work.
Supervisor Duran.
Yeah, no, really appreciate the presentation and where you're going with the information and the transparency. And this by no means is not a criticism at all, but there's an old adage when it comes to anything data-driven, garbage in, garbage out.
Absolutely.
What are your quality control to make sure that the data that goes in those are the actuals?
Right. No, excellent question. And that was something that in administration we were extremely concerned with ourselves. That's why we spent so much time training staff and working with staff to really understand what our coding system was, what these programs meant to them. They are our program cost accounts, or PCAs, is what we've used to align to our programs. Some of those we changed from just being numeric to actually being letters, because then we could spell out some acronym in their program or something that would mean more to them. We really took that to heart and spent a lot of time working with them, because we completely appreciate that if they're not going to use the right codes, the costs aren't going to go to the right program, and therefore the data is not going to look correct. On the output side, that's why we wanted to standardize our reports. We spent so much time working on the report template and making sure we could automate it, make it streamlined, so that when they see the data once a month, before too much time has passed, they could look at it and assess, does this look right? Does this person really belong in this program? Is this where all those costs should fall or not? And they do know those things, and when they see that data in front of them, they say, no, this is wrong, and we fix it, and we make it right, we make it better. So that's really why we focused on both sides of it, so that it would be accurate.
So is there the ability for you to do, hypothetically, an audit, make sure that they're doing the correct codes?
Absolutely.
Okay.
Yeah, and we have monthly meetings where we meet with them. Like I said, we share these reports. We have a very open dialogue to say, all the program managers are there. Sometimes they bring their program supervisors, and we sit down and walk through it and really ensure, is this correct? Is this what your staff are doing? Is this what you would expect them to be doing? And it's actually been an eye-opener in a very positive way for managers to understand and supervisors to understand exactly where every minute of every day is going for their staff.
Sure,
So,
because it seems to me that you'd have the ability to really turn around the input of incorrect data with frequent auditing. So,
right, exactly. No, it's
Thank
great.
you.
Thanks.
Supervisor Montgomery.
Thank you, Rebecca.
Yeah.
I think I'm on.
Yep.
Great report. I had a couple of quick questions. One of the things that you said in the beginning was that one of the things you had to do was look at what's mandated versus what's not mandated.
Absolutely.
So I'm assuming that when we say align HHS program structure to Placer County priorities, that's everything that's not mandated, understanding that we need to, whatever's mandated, we just have to do at whatever level it's mandated at.
Right. So I don't, honestly, we're kind of waiting for a little bit of that direction, but that's why we wanted from the start on our side to identify that. So when that direction does come down, we will be able to, if you do want the mandated separate from the non, and then we're prioritizing the non, we absolutely can set it up that way.
Okay, I just think about it as, like the state budget, where
Sure.
85% of it is things that you just have to do, and you don't have any discretionary opportunities to do anything different
Correct.
or in a different way, and it can be a little frustrating, but just understanding the parameters, I think, would
Right.
be really helpful. And then the other question is related actually to some of Dr. Marbott's recommendations on homelessness. Is there a way to, or perhaps that's already happened as part of your phasing, is there a way to integrate the HMIS data that we gather into either the program structure that we're creating for priority-based budgeting or for this sort of tracking?
Yeah, absolutely. I mean, that would be the local data. We could develop some indicators that we would want to monitor regards to the homeless population we're serving, and we could put those indicators on the webpage and utilize that. So absolutely, yes.
Great, because I'm just trying to, as we move forward with anything related to health and human services and public safety, trying to figure out how we take some of Dr. Marbott's recommendations and roll them into that more comprehensively. Thank you.
To Supervisor Montgomery's point, in terms of weighing the priorities, the mandated versus the non-mandated, those are fairly black and white. Then you have the additional layer of funded versus unfunded. So something that's mandated and funded is going to probably be at the top of the list versus mandated non-funded might not have as high a priority. Is there some kind of an evaluative system built in here where consequences for not meeting certain thresholds when evaluated by either the state or the feds factor into how we determine those priorities? So in other words, if there is a fine for not meeting certain thresholds or what have you, then obviously it goes up higher on the list, perhaps even if it is a mandate but unfunded.
I think those are all factors that need to be considered when we have the discussion regarding priorities. And so, yeah, absolutely critical, needs to be included. I mean, certain projects or certain programs are more at risk for audits, and some of the audits can result in hundreds of thousands of dollars of fines if those programs aren't implemented correctly. So, so it does lead to more weight on them in terms of moving up the priority ladder.
Okay. And then the slide 4, in terms of analyzing the successes of the priority-based budgeting pilot, Supervisor Holmes touched on the little box, empowers program staff to own needed changes. Can you give me some examples of where you've seen that kind of starting to take hold and where staff has been able to engage at that level?
Yeah, sure. So some of the changes would be as basic as a staff person and where they're putting their time and what programs they're working in. And especially in public health, we have many different grant funds that funds pieces of people. And so it gets really difficult with our salary matrix to try and actually track all of that. And so program managers have been, chomping at the bit, really wanting that information to be able to see, is this the right amount and the right mix of a percent of a person that we've now reported to the state in a budget that we're doing. And so now they're able to get that, and they're able to come back and say, no, that's not correct, when before it was administration maybe just telling them, doesn't look like your staff are in the right place and we need to work on it. Now they're seeing it and saying, wow, we really need to make these changes, and this person is not spending the time where they're supposed to or where we told the state they are, so we need to go back and make some corrections and adjustments. So.
And I can see, again, this getting us right back into that, where I asked Andy previously in terms of duties, descriptions that get codified in our positions through our civil service and all the rest. It's just, so we have that additional layer that we need to work through as well. Okay. I'm not seeing any other lights lit up by board members, so thank you very much
Thank
for
you.
the presentation.
Thank you for your time.
And Andy, at this point, do you want to introduce the fire department's presentation?
Thank you, Jeff and Rebecca. What I'd like to do now is call up Chief Michael Schwartz with the North Tahoe Fire, and what he'll go over is what they have done with implementation of a form of priority-based budgeting, keeping in mind that again, there's no one-size-fits-all with this. This is going to be catered to the organization, and I think what you'll find with Chief Schwartz is that he's done just that, and he'll go through his process with you.
Good. Thank you very much.
Do you want me here or you want me to talk?
Whichever you're more
I'd
comfortable.
rather sit here if you don't mind.
Please,
Yeah.
please.
And then I'll have to start my backside.
Yeah, that's.
Yeah, I'm conscious. Is this not on yet? Well, good afternoon, and thank you for allowing me to be part of the conversation. For the record, Michael Schwartz, North Tahoe Fire Protection District. I know I'm off to a good start. But actually, that's probably an appropriate gaffe there, because I started this in my previous organization. So to give you a little background, I've actually been in the implementation phase of 3 organizations through the priority-based or priority-driven budget system. So I actually have a lot of experience in the first couple of years of what the pitfalls were. So I'm going to go through my slides, and I'm not going to read bullet points to you so much. I'm going to try to pick a couple of key points to talk about. I'm going to go through them, but if you see something up there you want to ask me about, probably just stop me, and I can probably go into a little bit more depth I'd rather have it be a little bit more of a two-way conversation than me starting reading bullet points. So if that happens, just kind of throw something
So
at
is this
me.
part of your lake-borne firefighting apparatus?
Yeah, that's got the 1,500 gallon per minute pump in it. Well, you'll see the second year. We used this slide at the beginning of the first year of the journey, and it is that. And I think one of the key parts in the organization for us was getting everybody involved and realizing this wasn't a one-year fix. It was going to take multiple years. And I used to tell people it's 3 years, and now I've expanded it to 5 because I know at year 3 we're not there yet. I'm pretty sure at year 5 it's going to say 7 or 10 because I don't think this is ever going to be an end point to this journey. It just gets refined every year. And so honestly, the big steps came in the second and third year, and I'll get to those in just a second. So yeah, right now, just to kind of put where we are, North Tahoe is in year 3. So where this 15-16 will be our year 3 implementation. Meeks Bay Fire is in year 2. And those are the 2 organizations that I'm currently involved with as far as the budget goes. Priority-driven budgeting and priority-based budgeting, like I say, I'll be used synonymously. Priority-driven budget, as it was talked about by Andy, is really based in zero-based budgeting as opposed to incremental budgeting. And I'm using those terms, and I'm not an accountant, and I don't play on television, and unfortunately, my administrative financial officer's in Italy right now, so you're going to have to hear it from me. But really one of the differences where in incremental budgeting, the current year becomes the basis for the next year. And I think we're all used to that, and that's what I was used to. You asked for $10,000 last year, and so this year, look, the numbers from the county says we're going to get 2% more, so now it's 10,000 and 2%. And that's the way I did business for most of my life in the government. Prior to that, when I was in private business and the money was my own to worry about, we didn't do it that way. We did zero-based balancing. So everybody said, hey, you got nothing, and now justify up what you need. And that's really more similar to what we're bringing forward as priority-driven or priority-based budgeting. And that's where I think some of the immediate value comes in. So basically, under priority budgeting, resources should be allocated according to how effective a program or service achieves the objectives that benefit the community the most. And that's kind of the basic premise. Next slide, please. Or do I have the control? Look, I can do this. Yeah. Without instructions, I got there. Okay, this is the basic overall philosophy. Like I say, I'm not going to read it, but it basically encourages personnel with budgets or line items to ask for only what they need for the budget year, not what they had in the previous year, and not what they anticipate in future years. And this one statement, as it becomes culture, actually probably frees up the greatest amount of capital availability. Namely because people aren't just kind of holding on to the budget because they're afraid, well, next year I have this large expense coming in my program budget, so I need to make sure that I hold on to my money for the next year and so forth. And so by allowing people to ask for specific year revenue requests, other programs will simultaneously all have the same requests, and so you're able to float more cash flow through. Am I making sense? Okay, now on. That's not that slide. That's blank. There we go. There's basically 8 tenets that we use for philosophy of priority-driven budget. These are the first 4. With that said, I'm not going to go into these. I think they're pretty self-explanatory. On the second 4, I think you've heard everybody talk a little bit about that. In order to be, and one of the things you'll end up on multiple years or subsequent years, you'll be judging your programs against is, did they do what they said they're going to do? And I think Chairman Euler spoke to this earlier, is that one of the things when you start to prioritize these, and we had to prioritize in our second and third years, one of the things you do look at is people come forward with a budget, and you look at the one from the previous year, and in one case, someone's asking for a lot more money the year before, and guess what? They didn't even spend their last year budget. And so you start to question those things. And then other people, really had spent all the money and yet only accomplished maybe half of what they had set out to in goals. And so now you question that spending practice, and in fact, they got put on a much lower in the priority list when we had to go through and prioritize. So, these kind of tenets end up becoming the driving force behind the program. I put this slide in a couple times. We start out because when I pull these slides out of 3 years of presentations, and I always start and end usually with this slide, because what I'm trying to tell everybody is, we do all this team activity in our rescue and our fire work and our emergency medical services delivery, but budget hasn't been that way. Budget has been, standalone, done by the fire chief or with the small executive staff, and the difference is that now we've asked everybody who has a program budget, even someone's a first-year firefighter could have a program budget, resupplying soft supplies for the ambulance, which could be $10,000, $20,000, $30,000, and they've never had any experience. And so what we're starting to do is we call them budget road shows. We go out and reach out to all the fire stations and all the firefighters, and it's time-consuming. But we have these discussions on how we're going to prioritize our budgets and what we're going to do to get them involved and give them some help. And they're not just thrown to the wolves at that point. We provide them support throughout that, but it does allow them to have a little bit more of an education when they're developing their own program budgets. And I'll just kind of show you the form in a second here. Any questions so far? Okay. So identifying organizational needs, I just threw this slide in. This is actually a revenue slide, expense slide from 11/12, I think. But basically what we're trying to say is that trying to maintain your organizational needs during flattening or declining revenues, cost pressures, and increase in service demand. So all that to say is that, when times are good and when our budgets are flat or even a slightly incremental raising, we can usually figure a way to maintain our existing services delivery. Where this really became difficult is when all of a sudden we're faced with budget declines. And I think that one of the things that's an interesting kind of a case study is that when you look at governmental budgets in cycles, we go through this about every 7 to 10 years. And so what ends up happening is the people who are running organizations through the difficult times aren't there for the next cycle. And so that we don't have these tools in place. And so, we lose our hair and we go gray, and then the next team comes in and maybe they're there for the 7 or 10 years that the times are good, but guess what? We're going to go back into this again. So what I'm really hoping at this point is we're starting to see a resurgence of revenue, is to put the tools in place that we have the next time this goes around, that the people managing the organization will already have the tools in place to make the tougher decisions, really without going behind the closed doors in a red pen and doing draconian cuts. So part of what we do is we determine the total price for the price for government for the upcoming year. And this is an interesting part. You put revenues before expenditures. This is very much like we should be doing with our own homes, is we figure out how much we're going to actually make before we spend it. And this is a sort of a change in philosophy for the organization is, we would build it off the previous year budget. Now we're building our budget off the revenue anticipation. So you can kind of see this is almost turning things upside down as far as from when you're trying to develop your program budgets. The program's basic attributes and priority results are probably the key and the greatest value both to the organization and to the public. And I'm going to talk about both of those in just a second. I think this will help some of your questions you had earlier about how you're starting to score these things. I want to mention that they're ideally developed an ongoing process through your stakeholders that you talked about earlier. In our case, in year one, we did it with executive staff, division heads, managers, and then with some line staff, and then with our board of directors. We also have a community advisory committee that we were able to help sort out some of our priorities as well. So basic attributes, at least for North Tahoe and Meeks Bay, mandated programs that you talked about, those things that you have to do. Cost recovery of a program, which is that revenue stream associated with it that you also mentioned. And I think you hit right on some key points earlier, is truly that if you have a program that's mandated and has cost recovery, that's pretty high priority, and especially if it's in your core of your mission statement. So, those things are certainly going to be at the top of what I call the float level. Demand for service and changes in service. So, what's the service demand? And sometimes this can be measured, and we've done this on certain programs, by just contacts. How many contacts do they have with the public? You could have a public information officer or a chipping crew, or you could have your EMS program each having measurements. One of the measurements is how many contacts do they have with the public, I think is one of the ways that we've used it for that. And then reliance on the district. It's kind of like, okay, if not you, then who? So if you're not going to do it, if you're not going to put the fire out, who's going to put the fire out? And is there somebody else to do it? And, in our search and rescue is the domain of the sheriff's office. So as we mission creep into that, that's a program you could say, well, maybe we shouldn't be because somebody else actually does that. Or, the Coast Guard does water rescue. Maybe is that something, those are things you have to ask yourself during tough times. And those are some of the things. So is it a core function of the organization? Does it have revenue? Do fans or change the surface? And that's kind of what I covered there. Okay. Priority results. Very much tied to the district's mission statement. Didn't change. There we go. So the district safety and community health was one of the things identified by the stakeholders as being probably the single greatest thing as far as results for the programs. Fiscal responsibility. So there's that do exactly what you said you were going to do. Community relations and public education is always a key piece, and then sustainability. So the sustainability part came in as part of this last revenue recession we just went through, because we recognized we had programs that were grant funded and we had programs that didn't have long-term sustainable funding, and they really, got to, if you're going to plan your programs, you got to plan them with sustainable dollars. So this is just a lead-up slide into the form to show you how we take baby steps in the fire service. Year one in every organization that I actually implemented this process, all we ever really hope to accomplish is the form. We just tried to get people to use the form. And I know I can't read it on the slide, but so I'll go back. These are basically the pieces that we ask people to fill out regarding their program or line item even. And then we get them into using one form. That one form then translates right into Excel, into program budgets, so that once these things are returned to us electronically, they actually fill in the format for the Excel spreadsheets and the program budgets. So they may be filling out one line item of something that's maybe 10 or 20 of these forms, then that actually self-populates and becomes part of that, we call that program budget. So you're not looking at just one little line item, you're looking at something as a whole program budget, which could have everything from overtime, straight time. It could identify specific hard and soft products and all those things that end up making up their different budgets. So I think a couple of notes I think are kind of important. One of the things I stress is this is a funding tool, not a program cutting tool. I think one of the things that becomes, sort of takes over the organization as you're going through this process is they have this fear that, oh my words, my program's not going to get funded and it's going to go away. And so one of the things I stress is that this is not where we cut our programs. We cut our programs in the operations or my desk. We don't cut them at the budget planning process. Now, could programs wither and die over time? Yes, they can, but that's not the intent of this program. And so I try to alleviate fear as we do that. And so part of that is, as you're going through the process, is maintaining the objectivity and transparency as you go ahead and you're trying to prioritize the programs. And then, one thing I think, and this is probably obvious to you, but the results of the prioritization process are provided as recommendations to elected officials who hold the final authority. My favorite slide. So I like this because I think it's a really good graphic of what we do. And so that plane in the middle represents that annual funding level. As you put your programs in priority order, those things that have those programs that have higher priorities go above the float level, get funded, and the ones that don't. And on a year-to-year basis, that float level can go up and down. And as it does, you may fund programs that in the previous year didn't have enough priority to be funded. Or additional revenue can come in. And so we're in that process right now as we come to the end of our fiscal year. We're going to be able to fund some additional projects that we didn't think we could fund at the outset of the year, but because of program savings, we are. Just a couple quick slides here. This was just the end. Basically, we did the review, and this is our year 2 slide. At the end of year 1, we reviewed our year 1 experience. So for us, at the end of our first year, we balanced the budget, which hadn't been a few years since it had been actually balanced. We actually completely reduced our dependence on unrestricted reserves. We're not having to use any dry period funding, and we made additional funds available for the we added 4 additional firefighters back that had been lost during the recession through attrition, and we leased purchase of 2 new Type 1 4x4 fire engines. So that's pretty good for year one, for an organization that, has $11.5 million budget now. Year two program goals consisted of a couple of additions. We grouped our budgets. So I told you year one, we just got them into forms. In year two, we grouped them. They should be set around your strategic goals or your priorities as you set with your stakeholders, and have the ability to have measurable outcomes. So as I wrap up here, a couple of future considerations. I think as I mentioned in the beginning, the priority-driven or based budgeting is a scalable thing. So I think it's not a one-size-fit-all. I think you can pick the principles and apply it to the organization as it most fits your organization. That's sort of what we've done. It puts tools into place to manage the future shortfalls, as I talked a little bit about. But it does take commitment from everybody in the organization, and it does end up taking it some time. And with that said, I'll answer any questions you might have to the best of my ability anyways.
Questions by board members? Supervisor Montgomery?
Thank you. And I say really handsome guy in the front row there. Sorry, not you.
I saw that.
I did have a question about one of your slides. There was, you said score decision units against priority results. I don't know what that means. Can you explain what that means?
Yeah, let me go back to the slide here. So as you start to build your programs and you have your priority results, as the programs get submitted each year, and you've asked them to provide those priority results that I talked about a couple slides before this, one of the things we do is how well they've done in achieving those priority goals. Then we score those and we put those in priority order.
Okay, what's a decision unit, I think is what I'm asking.
Sorry. That portion of the program, the decision, we haven't put a number to yet. So for our organization, where we've scaled this to fit is we've put things in priority order. But as we work into year three, it's exactly what we'll be doing now is trying to, the decision unit is sort of a numeric value, how you're going to put on each portion of your priority outputs.
So then the next slide to this one, those are decision units on your scale.
Exactly.
Got it, thank you.
And so, my hopes when we started the program is by year three we'd be there. And I realized as we were implementing that as it was said earlier by Supervisor Duran, it's a very difficult process as you go to put an objective number to something that's oftentimes very subjective. But that is the process we're in. I'm really glad we're doing it at a time when we have an economic increase, because you could see how hard this would be to do that particular part of it when everybody's fear of losing their programs. I think we can do it right now with trust. And we'll be able to do the program in the next couple of years, and like I said, then have the tool available when it's more difficult again.
Thank you, that was very helpful.
I hope so.
Any other questions for the chief? I don't see them.
All right, well, thank you, and thank you for allowing me to speak.
Thank you, Chief Schwartz, for sharing your experiences with priority-based budgeting. As you can see, that this is it's a long-term process that the county is going to be embarking upon. We've been in it for a couple of years already, and there's a couple more years of work to do. But we are making progress, and I think that we will ultimately get to the point where we want to be. One more slide. Can you go back to my slide presentation, if possible? Okay. So it's just a wrap-up slide to this item in particular. Some of the next steps in the process, as we look to fiscal year 15-16, for which the current budget is being developed, proposed budget, we will be refining, as I mentioned, the program and services inventory, trying to get it to be succinct in its definition of the programs and services that are provided to the community, and a little bit more consistent in the way it does it. Stakeholder engagement is going to be critical moving forward, where we can get affirmation and then refinement of some of the system's goals, if that's the path that we decide to go down, and overarching strategic priorities that may center around some of those systems goals, knowing where we're going with priority-based budgeting. Again, capitalizing on what we've learned from HHS in their pilot process, and with the 7 departments that are coming forward with the 15-16 budget, alignment of cost to programs, where we'll know exactly what it is that each program and service for the county is costing, less any non-discretionary revenue sources that are associated with that program, and then development of a program and services evaluation criteria. This is something that we're going to have to really put our thinking caps on. It's something that we ultimately will need to be bringing forward to indicate how each program and service, by virtue of the level of service that it provides and some of the things that it does to meet the priorities and stated objectives and the strategic goals, is doing. What is the compelling public value, and how are we measuring that and gauging it? And then ultimately with fiscal year 16-17, which will be the next budget that's developed, we'll be developing and considering a budget using priority-based budgeting as an alternative, where the budget will be presented in a format that is based on priority-based budgeting as a complement to the existing budget, perhaps, where your board will have that as a tool to consider what's being brought forward and recommended as part of the proposed budget. So that is the end of this item in terms of the staff discussion. Any other questions that your board might have?
Okay, I do want to leave the opportunity for any members of the public to address the board on this and take any questions folks might have that might have come up as a result of this conversation. But first, is there anything else any other member of the board wants to add? Okay, any members of the public or staff have any questions brought up by what we've been over so far today? All right. We accept unanimous consent. Move forward.
Okay, thank you. That's what we'll do.
All right, why don't we take just a quick couple minutes, and then we'll come back for our item B, which is the Lake Tahoe area revenues and expenditures Tahoe budget discussion. Let's just break for 5 and then come on back.
Thank you.
Go ahead and take up item 1B, that is the Lake Tahoe area revenues and expenditures Tahoe budget conversation. Andy, this one's yours as well.
Thank you, Mr. Chairman, members of the board. This item will be discussing the Lake Tahoe area revenues and expenditures, otherwise known as the Tahoe budget analysis. And before we actually get into the conversation about Tahoe and the revenues and expenditures, I'd like to show a short video that's been put together by our public information group that kind of sets the segue for the conversation.
Time for Tahoe True or False. Lake Tahoe is often called the 8th wonder of the world. True. It's the largest alpine lake in North America. True. It's over 1,600 feet deep and 22 miles long. True. It's the cash cow for Placer County. False. You've probably heard the rumors. Now here are the facts. This is the area in question. Some call it the East Slope. It's everything east-southeast of Interstate 80 and Hampshire Rocks Road. The same area as the 10% TOT rate collection area, or the transient occupancy tax, collected from visitors at hotels, motels, resorts, and vacation rentals. In just that footprint, there are 88 different tax rate areas. Each individual area is unique and has its own tax structure. The bottom line is, when we talk money and budgets, it's crazy complicated. Just as we can't provide services differently from tax rate area to tax rate area, we can't budget from community to community. We have to budget county-wide to make sure that everyone gets the services they need for the best possible price. But inquiring minds wanted to know, how much revenue does the Tahoe area bring into the county treasury? And where does that money actually go? So we took a look at the 2013-2014 fiscal year for a snapshot in time. First, the revenue. When you combine property tax, TOT from hotel stays, sales tax, and money paid for fees and services, grants, and all those other various sources of income, Tahoe brings in $61,481,849. So where does this money go? There's the big stuff that's probably obvious, like the Sheriff's Department, medical clinics, and the Public Works Department, which maintains the roads and does snow removal. But there's so much more that you might not think of right off the top of your head. Child Protective Services, animal control, libraries, parks and trails, tourism development, economic development, permits, code enforcement, the TART bus system, yes, that's us too, social services, probation, environmental restoration, and much, much more. Placer County employs about 155 people in the Tahoe area, most of them in Health and Human Services, Public Works, and the Sheriff's Department. All that adds up to $58,239,576 spent on projects, services, and programs in Tahoe that year. Let's do the math now. Okay, so 9 minus 6 is 3, 4, okay, never mind. Let's just use a calculator. The difference is just a little bit more than $3.2 million that Tahoe paid in county revenue, more than was spent in county services in Tahoe for the 2013-14 fiscal year. And that's going to change from year to year. This particular year in question, there was next to nothing in snow removal, while just 3 years earlier, it was an extra $2.5 million for snow removal. Every year will be different. And when you consider there's only about 5% left over in this particular year to pay for county-wide services that also benefit the Tahoe area, like the assessor, elections department, treasury, and others, we're pretty much at a break even. So there you have it, Tahoe by the numbers. I don't know about you, but I'm ready to go outside for some fresh Tahoe air to help clear my head.
Yeah, that's pretty much the item.
I'm
so no-
thinking short of a jingle, you got a little Schoolhouse Rock-ish there. Conjunction, junction, what's your function?
Yeah. But first, thank you to Dee Dee Cordell and her group for putting that video together. It really demonstrates what we'll go through in a little bit more detail than might be provided by a doodle video. Looking at the Lake Tahoe area revenues and expenditures, purpose of this item again is to provide an overview of the estimated magnitude of revenues generated in the Lake Tahoe area, both discretionary and non-discretionary, which will become very important to understand what those are, and then the service delivery costs incurred specifically for services within the Tahoe area. And this is not meant to be a perfect analysis, and it's a snapshot in time. It's just for a given period of time for fiscal year 13-14. And going through my presentation today, we'll discuss what is the Tahoe budget analysis and why it was prepared, the data accumulation methodologies that we worked on with the departments in the county, Tahoe budget analysis results, looking at the results of the analysis as a whole, and then some of the key takeaways of those results. Looking specifically at the Tahoe budget analysis and what it is, the budget analysis is an analysis of the fiscal year 13-14 fiscal data related to county services provided in the Lake Tahoe area itself. The revenues are generated within the Tahoe area, so it's just those revenues that are specific to the Tahoe area from both a discretionary perspective and a non-discretionary perspective. Only provided as an analysis. Note that the budgets are not typically put together by geography. As you saw in one of the areas of the video, there are numerous tax rate areas, and budgeting from tax rate area to tax rate area based on the amount of taxes that come into that area, which vary from area to area, is not really a good fiscally prudent way to put together a budget for the county as a whole. So we'll be going through that. Why prepare a Tahoe budget analysis? And this is, again, to determine the estimated magnitude of providing county services directly to a defined Tahoe area. It's just for Tahoe-specific services that are provided in the Tahoe area. As mentioned in the video, the Tahoe budget analysis geographic footprint is the TOT, East Slope TOT collection area, which essentially is the area east-southeast of Hampshire Rocks Road and Interstate 80 and everything to the border of Nevada and then all the way to the lake. All of that area is geographically defined as the TOT collection area for a specific purpose because those TOT dollars are used in certain cases for specific items. So that is the area that we used. We called it the East Slope area. Looking at the data collection process, we worked with the countywide departments to determine the net costs for providing services within the defined East Slope area geographic footprint. We asked departments to identify all of the expenditures that are incurred to deliver the services directly to the Tahoe area, where we have labor costs for the approximately 155 employees, labor and benefits in the area, costs for materials, supplies, and contracts for everything that's incurred in the Tahoe area, and then costs for equipment and other capital-related items, which is significant in the Tahoe area when you look at the capital budget. and some of the things that go into the TOT budget itself. And then we asked departments to identify any non-discretionary revenue sources that are collected to provide these services. This is important because there are certain services that are provided for which fees, charges, grants, those sorts of things are collected, that those revenues have to actually be used for that specific service. We wanted to make sure that those revenues were identified specific to Tahoe so that the expenditures would be credited with those amounts. There is an attachment in your memorandum. I think it's attachment 1 to the memorandum that actually discusses all of the total costs by each department and then the non-discretionary revenue sources that were identified by each department as well. And then the overarching programs that those costs and non-discretionary revenues actually are for. What this slide does is it looks at a core program within the Public Works Department, knowing that in the Public Works Department they do many things that total about $22.4 million in total costs attributable to the Tahoe area, of which about $13.1 million is received in mostly federal and state revenue sources, some grants related to capital activities, and then road maintenance activities. Looking at a core program within the Public Works Department specifically, I've identified roadway maintenance, just specifically roadway maintenance, where you can see that for roadway maintenance activities, there are $5.5 million in expenditures incurred in the Tahoe area with about $1.8 million in offsetting non-discretionary revenue sources. What this means is that about $3.7 million for roadway maintenance specifically needs to come from a discretionary revenue source, i.e. sales tax or property tax from the general fund, from the net county cost. Looking at the results of the department-specific information, we have about $58.2 million in expenditures that have been identified countywide, and that's offset by $20.6 million in offsetting non-discretionary revenue sources. The balance basically has to come from discretionary revenue sources. What are those discretionary revenue sources? Discretionary revenue sources are typically collected to support budgeted and priority countywide services and programs. These are the dollars that go to support the county as a whole and make up essentially the amount that goes into the budget as net county cost. Property tax collected in the Tahoe area is about $24.5 million. Again, this represents collections of property tax specific to county general fund, county library fund, and the fire control fund in total for the 88 tax rate areas that are defined within the Tahoe area geographic footprint. Transient occupancy tax collected, about $11.5 million that comes into the Tahoe area. Sales tax, about $2.6 million, and sales tax is computed as the amount of sales tax just in the Tahoe region as defined, where we actually have what we call geo reports that are produced by our sales tax consultant, HDL, that identify the sales taxes collected from a certain area, in this case, the Tahoe area. We also collect public safety sales tax, which is about $1.7 million. And these next three that I'm going to go through, public safety sales tax, the highway users tax, and local transportation funding, are not typically considered as discretionary revenue sources. However, for purposes of this analysis, I put them in as discretionary revenue sources because they're discretionary in that they can be used in any area of the county, not specifically to the Tahoe area. So for the Tahoe area, they're discretionary. Public safety sales tax, about $1.7 million comes in for that, and that is based on the amount of sales tax collected within the Tahoe region to the amount of sales tax collected in the county as a whole, the proportion thereof, the portion of the approximately $40 million that's collected for public safety sales tax. Highway users tax and local transportation funding are based on population. I think we used about 13,880 people in the Tahoe region that are residents in the area compared to the 350,000 plus residents in Placer County. So that portion of the population is applied to the amount of LTF, local transportation funding, and highway users tax that's collected. And then that is the amount that would accrue to the Tahoe budget. So the total amount of discretionary revenue sources is about $40.9 million that's coming in into the Tahoe budget. Looking at the total results, the cumulative results, you can see the total cost of providing services and programs that's been identified by the departments is about $58.2 million. That amount is directly offset by the non-discretionary revenue sources, those fees, grants, charges, the things that are, the revenues that are collected specifically for providing a service or a program in the amount of about $20.6 million. And then we have those discretionary revenue sources that are about $40.9 million, which leads to an analysis outcome of about $3.2 million on the revenue side. Some of the notes that I have here is that 66% of all the revenue sources are discretionary, keeping in mind again that these discretionary revenue sources typically go to offset services for county-wide services. And that these services and program costs typically do not include, especially for this type of analysis, the full array of county-wide costs that may be attributed to the Lake Tahoe area. For example, certain indirect costs may not be included, and then services provided for the Tahoe area, outside of the Tahoe area. Some of the indirect costs that may be mentioned would be, let's go back to my notes here. Providing budgeting oversight related to the Lake Tahoe Tourism Promotions Fund. In our office, in the CEO's office, we put together the Lake Tahoe TOT budget, basically. And there's time that's spent by staff to put that together. However, that time may or may not be charged, in most cases may not be charged to Lake Tahoe specifically. So that is a cost, an indirect cost that accrues, that should accrue as part of this analysis. It's simply not included as part of that analysis. And then in costs for services available to countywide residents that are not included in this Tahoe budget, the example I have is certain criminal justice costs to the extent the Tahoe area arrest results in processing through the criminal justice system. Something may transpire up in Tahoe, however, it may take place down in Auburn and or Roseville, where those costs associated with that may not come directly back into the county. So it's costs for things that are countywide in nature for which those discretionary revenues are collected. Another good example of that might be the elections, where there's a specific election that is happening up in the Tahoe area that's not specifically charged to the Tahoe area. It's more or less charged through an indirect cost that is not accrued as part of this analysis. So that's just that. Some of the key takeaways of the results. Tahoe budget analysis represents a basic quantitative analysis of county revenues generated in the Lake Tahoe area versus expenditures for direct services and programs provided to the area constituents. It's just a basic analysis. It's based on the information that was received by departments for the expenditures incurred for the services that are provided as offset by the revenues. And then with that, the discretionary revenues accrue to this budget, to the Tahoe analysis budget, to offset those expenditures as well. These analyzed costs do not include certain indirect and countywide services costs for services and programs available to all Placer County residents, including those in the Lake Tahoe area, as I briefly mentioned. Both direct costs, those included in the analysis, and indirect costs will fluctuate to varying degrees from year to year. This is a very important consideration. One year, as was pointed out in the video, you may have an abnormal amount of snow activity where you're going to require additional snow plowing that may or may not be reimbursed by the state. Similarly, there may be fluctuations in the level of tourism that requires additional county services to come up and deal with the additional people that may be in the Tahoe Basin at any given time. And then, of course, a fire may break out that requires additional monies to be spent towards fire services and particularly management support, OES support that would reside down in the Auburn area and where those costs would be incurred. So there are a lot of fluctuations in costs from year to year, and it's important to remember that. The Tahoe budget analysis outcome is consistent with the results of the countywide budget results for fiscal year 13-14. With this, what I wanted to mention is that the amount of the $3.2 million, or the net outcome of the Tahoe budget analysis, is about 5% of the budget, Tahoe budget as a whole. And in the total fiscal year 13-14 budget for the county operating funds, all operating funds combined, there was about a 6.5% carryover fund balance that came over into the following fiscal year. So this is very consistent, ironically, with exactly what transpired as part of the countywide budget, where those revenues would be used just for services in the following year, depending on service fluctuations and where those services went. That's pretty much it in a nutshell. That is the Tahoe budget analysis, and with that, I'd be happy to answer any questions you might have.
Supervisor Duran?
Yeah, very good and very good information. I think it dispels a lot of the myth that we're using, you know, especially down in my district in the flatland, that we're taking from Tahoe. And that obviously your data shows that that is not true whatsoever. And I think we hear some of that in other jurisdictions as well, that, you know, folks in the more urban areas are using up resources. I did want to ask a question with regards to total non-discretionary revenues. The total non-discretionary revenues generated in the county entirely, that's that $20 million, correct? Or is that?
The discretionary revenue sources in this budget specifically is $40.9 million.
40.9, what does that represent? What percentage of that is of the total discretionary budget for the county?
I don't know off the top of my head.
It's about 10%? Okay.
Yeah.
Okay. Yeah, you know, it'd be interesting to see a breakdown of the different areas and the different supervisorial districts, because I think it would make a lot of sense when we are confronted with those questions as to where the resource is going, you know, that we can actually show what percentage of discretionary income is allocated to a specific jurisdiction.
Okay.
You know, so, but that's obviously in your leisure time. If there is such a thing, I don't need that tomorrow, so. But that's all, thank you.
Thank you. Supervisor Montgomery?
Yeah, Andy, first I want to say thank you, and I really want to thank David Bosch for taking this on. There has, as long as I've been in the position of supervisor, there's been just such debate about we are a cash cow or we aren't a cash cow. We're either a donor or a welfare recipient, depending on who you spoke to. And I've been asking for about 7 years to have this analysis done, just for my own interest, if nothing else. And I'm delighted to finally have had that occur. So I really want to say thank you to David, because I said, can we make this happen? And he said, of course. And then you did all the work, so thank you.
No. The departments did all the work.
Yeah. But a couple of things that I really just wanted to point out, because these weren't things that I knew before I became a county supervisor. So we talk about things like taxes versus fees and how those can be used in different ways. But I think first I just want to touch on the idea of property tax and what that means to people, because I hear folks say to me all the time, you know, I pay $10,000 a year in property tax. Let's say I pay $10,000 a year in property tax. How much of that actually goes to the county?
And again, it depends on the tax rate area that you live in.
On average for the whole
I would
county.
say 18%.
Okay, so about 18% of the property tax that we write a check to
Right.
Janine Windeshausen. She doesn't get to keep it, by the way. About 18% of that stays at the county. The rest goes to schools, airport districts, fire districts.
Correct.
All of that, okay. The other thing that I think is really important to understand just about tax and how government works, because I don't think anyone teaches civics anymore, and there's probably a few of us who are old enough to remember this, but I see some young faces in the audience as well, which is that it's the responsibility of the government, whether it's city, county, state, or federal, to collect tax across a broad system and then use it to supply services throughout that same broad system. And there are areas that pay more in tax and areas that pay less in tax, but we don't have a system that says, you pay more, so I'm gonna give you more, or you pay less, so you're gonna get less. We have a system that says, we collect, it goes into a pot, and out of that pot, we provide services to everybody at consistent levels.
Right.
And again, if you haven't had civics, that's probably something people don't understand. Fees, on the other hand, are very specific for a service provided. If if you come into our building department and you are applying for a particular permit, there are specific fees that are associated with that because of the cost of employees doing specific things and looking up things and filling out forms. Very, very different from how tax is used. Sorry, it is a little Schoolhouse Rock, Kirk, I apologize.
I'm just a bill.
It's just a bill up on the hill. I just, again, I really want to say thank you. I want to also just reiterate what was in that fabulous video. Thank you, Dee Dee. I think Dee Dee put that together. You know, that this particular snapshot in time shows a difference of $3.2 million, roughly.
Right.
But any given year could be in deficit $3 million.
That's right.
We've seen those snow years. We actually want them to come back. Again, really, just thank you. Thank you to CEO staff. I think it's just so important that we've actually been able to finally look at some real data. This data is available. If anyone would like to look at it in more depth, it is available for folks. It's all public record. We're happy to have you come in and look at it. Thank you all for coming today, and I'm sure Supervisor Euler will be opening up for public comment.
Yes, I will. But first, I wanted to say a couple things. So kind of in the vein of the conversation that we just had in terms of priority-based budgeting, I think given this information, it's now incumbent upon us to figure out under the auspices of priority-based budgeting, now that we do understand the revenue streams a little bit better and the cost of services a little bit more precisely, how do we make those strategic investments that help us further drive those revenue streams that are somewhat unique to this area, the TOT clearly being one of them. And then, of course, what we can do to minimize the costs of providing services just based on priorities and those tools that are available to us through our different service delivery methods, so that we do see that delta grow, and not just in the Tahoe area, but in all areas, but clearly up here, a little bit different than other areas of the county driven by other economic factors. You do have an infrastructure up here that does require a little bit more flexibility, I think, because the mood of the traveling public, which does drive a lot of the revenue up in this area, the mood of the traveling public does change a little bit. It is a little bit more dynamic than the economy as a whole, and the amenities that they might be looking for in any given year. All years include snow, by the way. That's not a negotiable item, so get that back. The mood of the traveling public and their dollars being flexible more so than, say, an economy based around technology or service, which is, in other parts of the county. So understanding that, and understanding that the things that might attract those opportunities for additional revenue capture, I think, are more dynamic in this environment than we do see in other parts of the county. Mm-hmm. So as we look at our priority-based budgeting, understanding that those priorities might shift a little more readily up here than they do in other areas. Right. So with that, it is time for public comment. If anybody has any comments they want to make on the presentation that we've just seen, please go ahead and address the podium at this time and state your name and engage in the conversation.
Deeply disappointing.
Or not, I guess.
They're waiting for the bar.
Yeah, I was going to say, it's all set up out there. All right, well, yes, Supervisor Montgomery.
So I did actually just receive an email that I wanted to address because it's from someone sitting here in the room, and they were expressing how much they hate the fire tax And two things, I hate it just as much because I pay it. I think actually quite a lot of us pay it. And it's imposed by the state of California. Unless they give us money back as a grant at some point in the future, we don't actually see any of that, very sadly. I think Chief Schwartz may be starting to see some of that money come back into the district, and I would strongly encourage you to get with Chief Schwartz to figure out how to advocate to get more of that back into the district. But I think we all hate the fire tax too.
Yep. Any? Yeah.
You're welcome.
All right, well, seeing no other comments and hearing no other emails that need to be read into the record, we'll go ahead and adjourn for Monday, and look forward to seeing you all back here on Tuesday. But with that, we have been invited to a reception to take place right outside. Now, it is listed as a timed item beginning at 5 o'clock. But I think since everybody's here anyway, we'll go ahead and probably start that timed item a little bit early. So with that, we are adjourned. Thank you.